This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, well, good morning. Try to make this quick. So I recently did a medical minute on Narcan take-home kits and, how they're great. And there were studies that showed that even centers that do them, ideally as possible, where they make it very easy for nurses to give them out without a doctor's order, don't do a great job. And then interestingly, we got an email in the last couple of days about our kind of rates and numbers here, and we're not great either. We probably give out between 10 and 15 of these a month, and we see way more patients who would be eligible. We should think about them and anybody who is on long-term opiates, even if they're not here for an overdose, because they are at risk for overdosing, or someone in their house is at risk for overdosing. So even if they're not here for overdose, but they're on long-term opiates, good to give them to them. Obviously, anybody who's here with opiate use problems, overdose, opiate withdrawal, good to give it to those. But other drug users as well, people who are on meth can sometimes accidentally get into fentanyl or other opiates. And then, just a couple of reasons to highlight why it's so important. When we see people for overdoses, their 1-year mortality has been shown to be close to 5%. So 5% of people that we see for overdoses who are otherwise totally healthy could be dead at 1 year. And even at 1 month, they have about a 1 out of 100 chance of ending up dead. And then another interesting study I saw recently looked at fatal pediatric overdoses, and 50% of those are from opiates. So 50% of the kids that die from some kind of accidental overdose are related to opiates. So if you've got kids in a house and you have opiates in the house, those people should probably have Narcan. So we should be much more liberal about giving Narcan take home. If you give a script, they're probably not going to go to the pharmacy and fill it, but we can give it out here. They take it home with them. So please, let's just remember that we should be very liberal. Remind the docs to write that order to give out those Narcan take home kits. Thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.